Okay, perfect. All right, so let's get started here. This is a topic that I have been asked to do webinars on before. It affects a lot of people. And so I have put this together with the hopes of, if I can get one good piece of information out there for you, I think it can be very helpful. So about me. My name is Kathy Biase. For those of you who don't know me, I'm an holistic nutritionist and cancer coach. I teach at the Canadian School of Natural Nutrition. I received my Bachelor of Science from the University of Toronto, and I went on to work on Bay Street, and then after I had my illness with cancer, transitioned my career, became a nutritionist and a cancer coach. And most of my profession right now, I would say about 90 to 95% of the people that I work with are cancer patients. I'm seeing more people that are coming in for prevention, which is just an awesome shift because we all need to be in cancer prevention mode, whether you've had cancer or not. So this has been a really inspiring shift that I've seen in my practice over the last little bit. I work at D Integrative Health, which is in Pickering, and I've been there for 6 years. So that's just a little bit about me. I love to do these webinars for you guys to keep you informed of different health topics. And here's all my contact information. If you want to get a hold of me or follow me on any of my social sites, there they are for you. Okay. So I'm glad you're here. I know I have some students here, and I think that this will tie in really nicely to what we've just talked about. If you are a person who has had bouts of seasonal depression, you're not alone. Depression affects more and more people every year. And again, this is a topic that is near and dear to my heart because I do know people that suffer from this. And so shedding the light on it, as in all of the areas of mental health, is a big thing for people. Knowing that you're not alone, knowing that you are, that there are lots of people who are going through similar situations, I think can be very helpful. If you want to interject here, if you want to add some comments as we're going through, do feel free to do so, and I will try and read them out to you. So let's get into the meat and potatoes of what we're doing. Seasonal depression, or seasonal affective disorder, is a type of depression, and it's related to seasonal changes. So the condition typically begins in the fall, continues through the winter months, and then you start to find relief as the days lengthen in springtime and March. However, though, some people don't know that some forms of depression can be caused in spring and early summer. CAMH, which is the Canadian Mental Health Association, reports that about 2 to 3% of people will suffer from seasonal affective disorder in their lifetime. 15% will be a more milder form, so maybe slip in and out of it during the seasons. But it still can cause a major disruption in your lifetime. So the common threads here and the symptomology, once depression gets to the point where you can't function, that's where you need to find help. That's where you need to find maybe medical help that can get you through this, along with a lot of the things that we are working on now. But again, the reasons for seasonal depression, there are lots of theories thrown out, and we'll talk about those, but there is no one underlying cause, which really leads to a lot of different approaches to it. Some common threads with seasonal affective disorders are symptoms can appear at any age. SAD, or seasonal affective disorders, commonly appear between the age of 20 and 30, and typically happen for people that are farther away from the equator. women are more likely to experience this than men. So why is this? Some experts believe that women are more vulnerable to their menstrual cycle and changes in the hormones, especially estrogen. And there is a theory that suggests that this roller coaster up and down of estrogen throughout the cycle. So estrogen will, in a normal cycle, will peak in the luteal phase and then drop precipitously in that phase as women get towards the bleeding stage. And for some, this drop can be extremely dramatic. And we'll get into some of the connections between estrogen and serotonin and brain health. But this roller coaster effect can really have an impact on mental health. And there are lots of connections between light and estrogen and serotonin, and we'll get into that. But this seems to be the reason why women are more affected, or at least it's the going theory of why women are more affected by SAD than men. Symptoms of seasonal depression are consistent with those that occur in other forms of depression. So some common symptoms we're talking about are, that down feeling during the day, almost every day, really lack of interest in doing things, especially things that you've enjoyed. So a real shift between what you find entertaining or fun. You may not find anything fun. Very low energy, feelings of hopelessness, worthlessness, irritability, loss of interest and pleasure in lots of different things, as I mentioned, feeling sluggish or agitated, having difficulty concentrating, that's a big one. And in very severe cases, as within cases of depression, thoughts of death or suicide, it's just an overwhelming sense that nothing is going to get better. But there are some unique symptoms to seasonal affective disorder that I want to point out. And some of these are carbohydrate cravings, increased appetite, and weight gain. So I want to throw out some suggestions as to why that is so. And you're going to hear this a couple of times because I think it's important to reiterate throughout the webinar. So serotonin is a chemical that is produced naturally in our brain, but mainly through the bacteria in our gut. Serotonin affects the way we feel. It affects our mood, helps us to feel happier and calmer, but it also impacts our GI activity. It impacts how fast food moves through our system, so our motility. It impacts peristalsis, which is that musculature, contraction and churning of the food to make it go down into the digestive system through the colon and out. It impacts how much fluid, such as mucus, is secreted by our intestines, and how sensitive our intestines are to sensation and fullness feelings, even pain. So just to backtrack a bit here, the fact that serotonin and the bulk of it is produced in our gut. So most of you here would know that the gut health is really where I live. And so the fact that serotonin production is, a lot of it is made by good bacteria in the gut, really highlights a connection between gut health and mental health. So we see it in a lot of different fronts, the vagus nerve connection, how our thoughts impact our health, but this is a real physiological connection to brain health. Serotonin functions as a neurotransmitter in the central nervous system and as a hormone in the periphery systems. Hormones and neurotransmitters are chemical messengers, but they're produced in different areas of the body. So neurotransmitters are more a central nervous system production, whereas hormones are from the endocrine system. So in making, in maybe enlightening you to that, we made the connection between the gut and serotonin and brain health. The endocrine system encompasses the microbiome. So many connections here that we can make for really trying to improve gut health to impact mental health, as well as all other areas of health. So back to serotonin. The sunlight increases the production of melatonin. And research is really starting to explore the idea that your skin, as with vitamin D, may be able to synthesize it. So that's kind of new stuff. It was new stuff for me when I was doing the research anyways. So the impact of being outside and sunlight and, really making yourself involved in outdoor activities. Oftentimes you hear go outside, it'll make you feel better. And that's true. And here's a connection as to why. In addition to sunlight, our body uses carbohydrates to create serotonin, which may help to explain the symptoms of carbohydrate cravings, increased appetite, and then, of course, weight gain. So making those connections, and as we move further on in the webinar, you may already be piecing together some ideas of how we can really make a positive effect against fighting seasonal affective disorder. As well, serotonin is the precursor to melatonin. So that serotonin that you soak up from the sun will impact the sleep that you have. Melatonin is a huge hormone player in good sleep. So that serotonin that you're soaking up or creating from eating good carbohydrates will also impact your melatonin production and therefore impact sleep. And we could do a whole webinar on the impact of sleep and good health. But just know from where we're taking it today, all these interconnections are, hopefully you're starting to see how we can really make positive steps to move ahead of maybe seasonal affective disorders or encourage somebody else who may be suffering from it. Okay, so back to symptomology. Symptoms most often occur in late fall and last through the winter. But as mentioned earlier, some people have the opposite pattern where the symptoms begin in the spring and last through the summer. It's not as common. Symptoms of specific winter onset are oversleeping, appetite changes, weight gain, tiredness. And symptoms specific to summer onset are insomnia, poor appetite, and weight loss, and perhaps agitation or anxiety. So of interest, researchers from the University of Maryland have found that depression worsened during peak pollen periods in people with both bipolar disorder and active pollen allergies. So it's not a straight line to seasonal affective disorders in the spring, but maybe this underlying inflammation because of the chemicals that are the cytokines that are produced when there's this huge histamine reaction, maybe that's the underlying issue here. Unfortunately, there's no direct line. We can't say this is caused by this, but we can certainly offer a lot of different angles so that there's hope for finding some method to help relieve the symptoms. So all in all, as I mentioned, the exact causes are not known. But I just want to go back and reiterate some of the things that I've alluded to. So one is low levels of serotonin. So recall the connection between sunlight exposure and creation of serotonin. So obviously, when we have decreased exposure to the sun, there will be decreased production of serotonin. Low levels of melatonin, that sleep-related hormone that's secreted by the brain, plays a role in sleep pattern and in mood. So low levels of melatonin have been linked to seasonal affective disorder. And again, make that connection between serotonin and melatonin. So you don't want to oversleep, but you do want to create a good sleep hygiene so that you can, especially during challenging times, have melatonin production going as it should within your circadian rhythm. So within the circadian rhythm, before bedtime, melatonin starts to rise. And as it rises, cortisol is also going down. So we want to make sure that stress is under wraps because if cortisol is high, melatonin will be impacted. If melatonin is impacted, sleep is impacted. And then again, if serotonin, the precursor to melatonin, is impacted, it's this great storm of the worst possibilities. You want to develop a sleep pattern ahead of the fall season. So you want to have your body well trained. So when we're talking about good sleeping patterns, we're talking about going to bed at the same time, having consistent things that you do. So a pattern, you want to sleep in a dark, cool room. I think people have been in my other webinars know this is coming back at you again, but there's no escaping the fact that good sleep is just optimally important for, optimal sleep is just vitally important for good health. So back to some risk factors. We talked about women. It is well known that, that the estrogen has a big impact. Estrogen is everywhere in our body, including parts of the brain that control emotion. And some of estrogen's effects include increasing serotonin levels. It also impacts the number of serotonin receptors on the brain. So when we talked about a little bit earlier, the peaks and valleys of the menstrual cycle for women, we're talking about its connection to, estrogen's connection to serotonin, but not just the production of it, but also the actual receptor sites on the brain that the hormone will lock onto. So, when we're talking here to women, we're talking about trying to have a luteal phase that is somewhat balanced and consistent. And that comes with dealing with nutrition, back to sleep. I mean, some women's cycles, just the up and down of estrogen is dramatic. So we want to support the liver with the detoxification of estrogen. We want to do everything we can. And again, this could be a whole other webinar to help estrogen do what it needs to do in a solid rhythm. So, if you are a woman who really is impacted by changes in your cycle, if you're coming up to that stage and oh my gosh, the mood's going to change and everything, it might be time to think of diet. It might be time to think of where we can, support that stage in the menstrual cycle to offset some of the peaks and valleys of estrogen. On the flip side of this, so we're talking here, I was just talking about the decrease in estrogen in the cycle impacting serotonin production. On the flip side of this is too much estrogen. So estrogen can affect the delicate chemical balance of neurotransmitters, especially GABA, we're talking about here, and serotonin, which will also impact mood. And too much serotonin can cause gastrointestinal distress. And again, this connection that we have to the brain and the gut. So, it sounds like we're kind of walking a tightrope and it can seem a little bit overwhelming. But if we attend to our major aspects of health, we can, this transition, we can really start to figure out where we need to insert different levels of care, whether it's on the supplemental side, whether it's on the exercise and lifestyle side, digging into the ebbs and flows of your own estrogen production can be extremely helpful. Other factors that are associated with seasonal affective disorder are family history. So people with SAD may be more likely to have blood relatives with SAD, which calls to maybe a genetic predisposition. If you are a person who suffers from other types of depression, bipolar depression, any other major types, the symptoms may worsen as you get into the fall season. And of course, distance from the equator. So we're really talking about the impact of light on seasonal affective disorders, the predisposition for it, and all of these things. So really talking about our system, our circadian rhythm, all of these things. But the real underlying piece here that I think we all know is that for some reason, this change in light for maybe all of the reasons that we've already talked about. This disruption of light, the shortening of the day, has a real impact on all of us who are, or on many of us who are farther away. And, you know, even if you don't suffer from seasonal affective disorders, I think all of us can agree that, you know, those gloomy days that we're going through now, November, December, where, you know, you get up and it's dark and you go to sleep and it's dark, it does impact your mood. You know, it's nice to be out in the sunshine. So you know, it's not a far reach to understand that this change and shift in light exposure can be very impactful on mental health. So treatment options, and we'll go through a few of them here, and hopefully if you're one of the people that are impacted, you'll find something here new that might be of value to you. There is a qualifier here. If your symptoms are severe, are impacting your life, as I mentioned earlier, you may need to go visit a medical professional. You may need some help medically getting through this time. You know, if family starts to see that you're being greatly impacted, these are all signs, and there's nothing wrong with getting help medically, because all the things we're talking about here can support any type of medical treatment. And the things I'm going to talk about here aren't necessarily cures, but they will offer relief in many cases. And, you know, we want as much of a natural approach to dealing with the symptomology of seasonal affective disorder as possible. So the most common treatment for seasonal depression, seasonal affective disorder, utilizes phototherapy for obvious reasons, so bright light therapy. And, you know, obviously the idea is to replace the sunshine that we're not getting. And it is effective for up to 85% of people to some degree. White fluorescent lights are used to mimic the sun. But let's take a look at some other ones. Okay, so in addition to light therapy, there are several science-backed, which is what I like, solutions for treating symptoms associated with seasonal affective disorder. So the ones that we're going to go through are a dawn stimulator, which is dawn simulator, vitamin D, diet, exercise, cognitive behavior therapy, journaling, bunch of things we're going to touch on here. Okay, so dawn simulators, and these are quite interesting and useful. It could be useful for a lot of different reasons other than seasonal affective disorders. What it does is it helps to produce and bring you into, it simulates dawn. So wake up lights are like alarm clocks that instead of waking up abruptly with a noise, they're going to simulate the rising of the sun. And the light intensity is increased by about, you know, over about 30 minutes, and it just helps you to wake up. I think there are dawn simulators that will have noises to them, so maybe bird sounds, things like that, but it's a gentle awakening. And researchers have found that dawn simulators are almost as useful as light boxes for helping with SAD. In addition, researchers have found that dawn simulators seem to increase athletic performance, enhance cognitive performance, and lift one's mood. So this doesn't have to be just between, you know, if you're not someone who suffers a lot with SAD, you know, you can use this instead of an alarm clock, a gentle wake up, a balancing of the circadian rhythm. Great idea if you don't want that jarring alarm clock. If you will wake up to light or the gentle sounds, this is a wonderful way to really start, you know, when I'm encouraging people to try and set their circadian rhythm, the first thing I want them to do is get up and open the drapes, because what that will do is it will tell the body that this is time to move, baby. It's time to get up. It's daytime. Cortisol rises. Things start to move. Our blood pressure rises, all in an effort to get us going because we've been stimulated with the light. So a dawn simulator can be an awesome addition to your morning. Helping the body to gradually wake up like this will help to stop. So back to the circadian rhythm, stop the production of melatonin, and that happens usually in the morning, and then really get the cortisol pumping. A lot of people find it much easier to get out of bed when they get used to these light therapies as opposed to the sound of the alarm. And it's just a gentle way to get into your day. Getting outside. So we've talked about this, but I'll go back over it again. Anytime you can get light exposure, especially natural light, it's going to be good for your circadian rhythm. But it's also, as we mentioned, very important for the production of serotonin. So, definitely we're going down the vitamin D path here when we're talking about getting outside. But if you are going outside on a cold day, you're going to be covered up a lot. So chances are the skin exposure to vitamin D is not going to be what is needed, but it can be helpful. But we want, we really are going to hone in here more on the serotonin. Again, it helps with the setting of the circadian rhythm. It helps with the eyes understanding. So it's, the eyes are not just for viewing. The eyes are performing a lot of different functions. And one of them is to recognize when we're out and about and moving and setting our circadian rhythm. Okay, so to vitamin D. Vitamin D deficiency has been linked very strongly with certain types of depression. There are two forms of vitamin D2, which is ergocalciferol, and you can find that in some foods like mushrooms, and vitamin D3, which is cholecalciferol, and that's found in oily fish, liver, and egg yolks. If you suspect that your vitamin D is low, and the symptomology for low vitamin D is all over the place. So I personally wouldn't trust just thinking, maybe my vitamin D is low. I suggest to all the clients that I work with to have your D levels checked twice a year. So you want them checked in the fall, winter time, and you want them checked then again in the spring and summertime. And the reason for this is that some of us hold vitamin D better than others. There is a genetic predisposition for some people to hold on to vitamin D more. We want to know what your right levels are so that we can offer you the right level of supplementation. So you can't go blindly into supplementing vitamin D. Too much vitamin D can be as harmful as not enough. So we need to find that Goldilocks space where we know where the vitamin D levels are at. So you need to get them tested. It is a serum blood test. Some doctors will recommend them for you. We're not at that space right now where most will, but you want to be checking that for sure. It may cost you $30 or $40 here in Canada. I think it's $30, but very worthwhile to get it done to find out where you're at, because you just don't want to go willy-nilly and start downing a ton of vitamin D. A study published in the Journal of Nutrients showed that participants who took vitamin D supplements experienced significant improvement in their depression if their levels were low. So vitamin D depends on many things, how well you hold vitamin D. There is a genetic predisposition, age, race, your latitude towards the equator. Different seasons impact vitamin D. As I alluded to before, when you're all covered up, you don't have a lot of skin exposure to vitamin D, and you need skin exposure if you want to be getting natural vitamin D. So in the wintertime, we're battling a few things. And so oftentimes supplementing with vitamin D is absolutely necessary. Diet. As mentioned earlier, SAD sufferers often crave starchy and sweet treats, and this is because the body is using them or wants to use them for energy and possibly for the production of serotonin. The body wants what the body wants, and it will crave and it will give you signs that it needs things. That dip in the day around 3 p.m, if you haven't had anything to eat, you want quick carbs, because carbs are the body's source of energy. So transforming your diet can make a significant impact on your well-being and mood. So you want to limit the consumption of refined carbohydrates, processed foods like cookies and crackers, things that just are devoid of nutrients. And so when you're shopping, you want to stay away from those areas in the grocery store. Don't go shopping when you're hungry. That's a death knell if you do that. And you want to get carbohydrates that are complex carbohydrates, whole grains, sweet potatoes, leafy greens, all of these things, rices, they're all complex carbohydrates, and they're what your body really needs. They're nutrient dense. And of course, we need carbohydrates for the health of the microbiome. The microbiome needs fiber. And recall that a lot of serotonin is produced by healthy gut microbiome. So real attention to the microbiome, fermented foods, things like kimchi, kombucha, these things, all these apple cider vinegar, all these fermented foods are wonderful for the gut. Research has found that including more omega-3s, fatty acids from like fatty fish, wild-caught salmon, mackerel, herring, sardines are great for the brain. Lean protein is very important. Lean protein is important for the immune system, for hormones, very important. So including all those in your diet. Additional foods linked to increased serotonin include foods that are high in tryptophan, because tryptophan is a precursor to serotonin. So all these links, right? And a lot of these things are bypassed and not really discussed a lot in the area of mental health. But our system is a consecutively built building blocks. So from amino acids, we break down proteins into amino acids. We take those amino acids and we build them into other things. So we need to supply our body with proper building blocks. So tryptophan is necessary for serotonin. So things like nuts, bananas, turkey, chicken, these are all good sources of tryptophan. And I also wanted to mention here, I'm a huge fan of whey protein, and some research suggests that whey protein will help reduce levels of cortisol while simultaneously increasing serotonin production. And that is because whey protein has tryptophan in it as well. Well, there are a lot of different diets out there with different targets and different claims. The one key underlying thing here is you want to have a diet that is full of anti-inflammatory foods. I've got a shopping list. If any of you want a shopping list, it's a Dr. Axe shopping list that I found that I can certainly send to you. But what we're talking about here is nutrients, a nutrient-dense diet, not the standard American diet, which is aptly acronym SAD as well. But you want to have a lot of nutrient-dense foods here, anti-inflammatory foods, because if the body is inflamed, it just impacts so many different things. Back to the microbiome again, and cytokines and things like that. And these will all contribute to bad mood. They will all impact the brain. So we want to give our body building blocks. We talked about protein, the importance of fats, complex carbohydrates to develop the brain, to nourish the brain, but we also want to be eliminating things that will detract from our health. So Dr. Axe, I pulled out his list. It's pretty comprehensive. So again, I'll send you it. But the foods basically, as I said, you want foods to alkalize your body, decrease inflammation. You want to manage blood sugar, because if your blood sugar is up and down and up and down, this will impact your mood for many reasons, but blood sugar imbalance is linked to insulin insensitivity, and it's linked to inflammation. You want to have a diet that is low in toxins, so as low as possible. So try and eat organic, try and know where your food is coming from. And doing all this will really help to optimize your nutrient intake. So we want to stack the deck in favor of good health. Okay, and movement. Of course, you can't get away from any talk of good health without movement. And exercise is a must for beating seasonal affective disorders. It can be a struggle when you're not feeling good to get up and move. So again, for people who know that they're coming into the season and it is a challenge, I encourage you to develop habits. So maybe get into the habit of every morning after you eat, go out for a walk. If you're working during the day, take part of your lunchtime and dedicate it to doing something that moves your body. Studies show that staying active increases feel good chemicals, increases serotonin, it helps lift brain fog. Um, and it's, it doesn't have to be a marathon run. And I say this all the time to people, they think that exercise has to be a real intense gym routine. And if you can get to that level, that's awesome. However, just move your body, get things flowing, allow your body to detoxify, get outside, get moving. So there are lots of different things that you can do to step into the exercise space. You can go hardcore in Pilates. You can have a yoga, do a yoga class. You can be involved in dance classes, cycling. As we get into the winter months, a lot of people, just to get outside, really just like to walk, which is just awesome. So many different things you can do. If you feel that being in a group is best for you, do it that way. Whatever works for you. You really need to sit down and think and strategize for yourself when you know you're coming into a season where your mood may be impacted. Cognitive behavior therapy. So this is can be very useful for people that are going through seasonal affective disorder. It provides a hands-on practical approach to problem solving. The goal is to change negative behavior patterns and thought patterns from the way you're feeling, to try and change those thought patterns into a more positive approach. A study published by the American Journal of Psychiatry found that CBT might be, cognitive behavioral therapy, might even be helpful for people, with any type of depression. So this is a very good therapy. You need to find the therapist that kind of suits and resonates with you. It's like finding a good hairdresser. Your therapist will start by identifying negative thought patterns and maybe give you strategies and ways to kind of flip the page on that. So this is another very viable form of natural approaches to care. And journaling. So we've got the power of journaling that comes up, virtually in every health space. It is something that I think is essential for working through mood issues, through depression. It can be a great tool for expressing yourself. No one needs to read this, so it can be daunting to start a journal. There are fears, even if you're going to be the only person reading this. It can be fearful writing down and just admitting to a book or pages some of your biggest fears, some of your challenges, but it can help you get to know yourself. And there's a lot of science behind the power of journaling. So again, this is something that you can work into your day. It can either be a set time, or what you can do is carry this with you and pull it out when thoughts are overwhelming you, feelings that you don't want are starting to percolate. Write them down. It can be extremely powerful and cathartic in helping you get through bouts of seasonal affective disorder. Along with journaling is a little bit more drilled down is gratitude journaling. Gratitude journaling can really help to lower stress, and we can talk about stress on sort of the emotional level. We can talk about stress on the physiological level and its impact on your hormones, but journaling has a lot of science behind it. Gratitude journaling helps to lower your stress, makes you feel calmer. It really helps to highlight things in your life that are positive, and that's what you'll need during these times. Again, it will help you to learn more about yourself. And you don't have to be writing grandiose things in these journals. I'm thankful that I have these new boots that I bought last year. I totally forgot about them. I'm so glad I found these boots today. I am thankful that finally it's a day of sunshine and it's not raining. They don't have to be, deeply thought out emotional things about gratitude. Things that that pop into your mind that make you happy. I'm really glad I read that comic. I'm really glad someone suggested that book. Cultivating small moments of positivity will add up into bigger moments of positivity. And aromatherapy. So this is the last one of the suggestions that I wanted to offer out to you. Essential oils are packed with potent plant compounds, and seasonal affective disorders affects not just us physiologically, and not just affects us in our mind, but can also have a real hit on us spiritually. It can hit all aspects. I mean, I think all of us can relate to a downtime, but imagine this going on for a long time. The beauty, that's the wrong word, I know, but the fact that seasonal affective disorder is, the timing is fairly consistent. It allows you to develop practices that can help prepare you for it and minimize perhaps some of the side effects and the symptomology. So essential oils have unique abilities to stimulate different areas of our brain, especially the ones that impact mood and our internal clock. You can use a diffuser. You can use some in your bath. If you put it in your bath, just make sure that you've maybe put it in an oil first. Direct contact sometimes with essential oils can cause some reactions. So you just want to make sure you don't have any reactions to it. You can make a spray. You can put a little bit of essential oil onto your pillow, lots of different things. I wouldn't put directly on the pillow, but I might put it on a cloth and then maybe put it on top of your pillow or very close to where you're breathing. Lots of different ways now. There are so many things. Roll-ons, a roll-on is great to have too. You can take it with you. Something citrusy and lemony during the day to kind of brighten your spirits up. At night when you're trying to sleep, think of lavender, bergamot, peppermint, chamomile. So during the day, you want to have those essential oils that are going to perk you up. And then at night, the ones that calm you. And these are really, really beneficial. I recommend essential oils in virtually every health situation that I'm in, because you're stimulating one of our senses, one of our five senses. And, when some of our other senses are not up to speed and we're not where we want to be with them, if our eyes aren't seeing things that pleasing us, you can look through your vision when you're depressed and you're not seeing anything that's making you happy. So if you can hit a different sense with good music, or your sense of smell with essential oils, you can offset to some degree some of the senses in your body that are not doing you as much service as you would like. So I just wanted to, do this webinar, hopefully, as I mentioned at the beginning, to give you some ideas if you suffer from this, ideas if you're trying to help other people. So quick and down and dirty. I like to be down in around 45 minutes. I have question time available for you if you want to ask any. Please, I'll go out of the share here, and please do feel free to ask your questions, and I'll answer them as best as I can. So thank you. I really appreciate you coming. I'm sorry it's been so long since the last one. I actually feel a little bit rusty. And, hopefully I'll have another webinar before Christmas. But if not, thank you so much for coming today. I will stop sharing. And if anyone has any questions, you can just type them in the chat there. Okay, it doesn't look like there are many questions out there. I hope you guys really enjoyed it. Oh, you're welcome, Soraya. I hope you guys really enjoyed it. As always, if you have topics you'd like me to cover, I'm happy to try and do so. So send me an email, message me on Instagram, and let me know if there's anything else. Otherwise, guys, thank you very much for joining me today. And oh, can you recommend a good dawn simulator? What I will do is I will put in a link here for it. Just give me a sec. I have one. Hold on here. Let me see if I can find it here. Okay. This is just something I grabbed, so you can take a look there, see if that helps you. I was not rusty at all, thanks. I felt a little bit rusty. So you can take a look at that. Grabbing melatonin tablets are recommended. I would work with a practitioner on that. I don't like willy-nilly supplementing with hormones. I think that they need to be supplemented by somebody who knows what they're doing. Melatonin, too much melatonin can actually impact dopamine. So what we're wanting to do here, the ideal, I mean, over a short period of time, I have used melatonin in situations for people. I've used it myself, but I usually do one round of it and then I'm off of it for a bit. So what you want to do is just encourage your body to produce its own melatonin, because we should be. So be careful if you're trying this yourself. Again, I do recommend you working with someone who kind of knows what they're doing with hormones, but ideally you want to work to create it. So really honing in on the circadian rhythm and balancing your hormones that way. Oh, you didn't get that? Do you see that link? Okay, hold on one sec here. Oh, I know why. It was my mistake, sorry. See that? Perfect. Okay, no problem. Anybody else have any questions? So do like, I think most of you, I think everyone here knows me. So just feel free to email me, say I'm a little bit rusty. Email me if you have any questions about this, and I'd be happy to help. Okay, everybody. That's it. We'll check out. We'll see you soon.